For this month's People Like Us segment, I'll be filling in for Roberta Gonzalez-Gregg, who's nursing a sore throat.
My money's running wild.
I bet hers is too. Get well soon, Roberta. Joining me for the interview will be Robert Smart, Program Associate at the Health Trust AIDS Services, Silicon Valley. Welcome to the segment where we honor the diversity of people in our community, people like us. The Health Trust AIDS Services is the largest provider of services to Santa Clara County residents living with HIV and AIDS and empowers clients and their families to solve their day-to-day needs. Some of the vital community services provided by the Health Trust AIDS Services include emergency financial assistance, transportation, food baskets, housing assistance, and a drop-in community center. Here to talk about the continued need for these important services is Robert Smart, Program Associate at the Health Trust AIDS Services. Robert is also the Minority AIDS Initiative Contact for Santa Clara County. Thank you so much for being here, Robert.
Thank you.
So tell us a little bit about what Health Trust AIDS Services offers to the Santa Clara County community.
Health Trust AIDS Services is the largest non-clinical service provider here in Santa Clara County. We offer food basket, which is nutritional supplements. We also offer transportation to our HIV clients, housing assistance, and we also offer case management nursing and some financial assistance.
Okay. So what are the goals that you try to achieve in your work as the Minority AIDS Initiative Contact for the Santa Clara County?
My initiative is to find people who have tested positive for HIV and not sought medical care, or people who have fallen out of medical care who are HIV positive and not seen their doctor in a year, and to help them get back into medical care and to help them find the barrier that prevented them from seeking the medical care.
Okay, that's so important. And how do you do the outreach? How do you, get people in the community to know about your services and to come in? And
well, I've done a couple of PSAs, public service announcements. Okay. I've done flyers throughout the county from Gilroy to Morgan Hill to everywhere else in between, all the way up to Palo Alto and Mountain View. Okay. Numerous community services, laundromats, you name it. I have posted flyers throughout the community to let people know that there is a service available if you are HIV positive and not seen a doctor.
That's wonderful. So what resources do you provide to your clients who come in?
My resources that I provide to the clients are that if they need to see the doctor, I help them make the appointment. If necessary, I will go to the appointment with them. I will give them transportation. I will speak to the doctor with them. I will sit in the room with the doctor with them if they prefer that they don't want to be alone.
That's wonderful. So there's a real personal touch there. That's got to be very reassuring for a lot of people who come
It is. My youngest client right now is 23 years old, which shocked me. And he came in and just sat and cried in my office. And after we made all the necessary arrangements for him to get medical treatment, and he was very comfortable with me sitting in there and listening to him because his parents or no one knows that he's HIV positive.
Yeah, so it's critical. It's critical that people know about this resource. So tell us a little bit about the Neil A. Christie Living Center.
The Neil A. Christie Living Center is a drop-in center for people who are HIV positive. We can come and have a safe place. We always have a coffee and a soup ready. And we offer educational services as far as health and exercise. And it's just a safe place if you want to come and watch TV.
That's great. So it's really an open community center and they can drop in whenever they like.
Yes.
That's great. Okay. So what shifts have you seen recently in terms of individuals being diagnosed with HIV?
Well, the largest right now in the United States as of May 31st, 2009, there is 56,000 new diagnoses of HIV. The majority of those are from the ages of 30 to 35. Next is 25 to 30 and the 15 to 25, which has increased over the years.
Okay. So we're really looking at the 15 to 35 range. And how do you think this is impacting our youth? How do you see that?
I think our 15 to 25 have this thing that it's not going to happen to me. They're invincible. And I think that no matter what anyone says or the education that is provided, it may not be fulfilling the need for our youth to understand that HIV is still out there and kills.
Exactly. I was going to say the educational resources must be lacking. if our youth are still engaging in risky sexual behaviors? And
I would say yes, the risky sector, because we as a community or as a nation do not talk freely about sex, because no one wants to know what anyone else is doing. Parents don't want to know their children are having sex, and children don't want to know their parents are having sex, and it's just like the elephant in the room, but nobody sees.
yeah, and it's so dangerous. We need to be talking about these issues. What impact has the economy had, and this major shift in the economy had on the services you're able to provide?
Well, because of the California initiatives and the prevention has been cut drastically, the center is now open only 3 days a week. Tuesday, Wednesday, and Thursday, where we were open 5 days a week.
Wow.
We have also lost 2 employees.
Oh, that's awful. Okay. Well, I want to thank you so much for being here.
And thank you, Breanna, for
And
inviting
thank you
me.
so much for the work you do. It's so important.
Thank you so much.
Okay.
Have a great day.
For more information about the Health Trust services, you can visit their website at www.healthtrust.org, or you can call 408-961-9850.